Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour where we explore revolutionary expansion of mind, body, and soul. Each time on the show, we have experts from around the country discussing cutting-edge topics on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. I'm excited today to have Dr. Pamela Cipriano on with us. She began her career as a certified critical care nurse. In 2011, she became an acute care nurse practitioner working as a hospitalist and intensivist. Recognizing the need for quality preventative health care, she earned her doctoral degree in 2016, and her dissertation, titled Preventing the Progression from Prediabetes to Type 2 Diabetes Mellitus, focused on effective strategies to halt the transition to full-blown diabetes utilizing dietary and lifestyle modification. Although the research had inclusion-exclusion criteria, outside the research she used the same modalities for patients with diabetes. Each patient reversed their diabetes using the anti-inflammatory diet designed by Dr. Cipriano and incorporating lifestyle modification. She became the first nurse practitioner in Connecticut to establish an independent practice. And after her son's delayed Lyme disease diagnosis, she joined ILADS, training with Lyme disease expert Dr. Richard Horowitz. Today, she specializes in Lyme disease, co-infections, chronic inflammatory conditions, and preventive medicine, helping patients regain health beyond medication alone. So welcome, Dr. Cipriano. How are you today?
Thank you very much. I'm very well, thank you.
Awesome, awesome. So that's really cool. Actually, first of all, I had no idea you were the first nurse practitioner in Connecticut to establish an independent practice. That's amazing.
It was more difficult than it sounds.
Yeah.
I had no idea I was the first.
Hey, like anything worth doing is more difficult and a hard work. That's for sure. For
It's
sure.
true.
But so I'm sure my listeners are curious, like coming from kind of what I would say a more traditional background, right? Like now you're involved in the more holistic line of things. So how did you kind of make that jump?
So I loved working as a nurse, loved working as a hospitalist, as a nurse practitioner and an intensivist, because that was like part of me. The hospital was pretty much my second home. And I got kind of tired of working the weekends and the holidays and all. And there was a physician who had retired from a dual physician practice. And the remaining physician was an older gentleman in his 70s. And I approached him because I knew he was looking for a provider and asked him if he ever thought of hiring a nurse practitioner. So he didn't even know what nurse practitioners can do. So I said, I have a great reputation at the hospital. I said, check around, let me know what you think. And then he pretty much blew up my phone and I got the job. And when I started with that practice, I took over the other physician's practice that had retired, and pretty much every patient either had pre-diabetes or diabetes. And I remember thinking, this has to get
It's
better.
crazy.
It was unbelievable how many
Yeah.
people, and they didn't know, like nobody told them that they had pre-diabetes or diabetes. So now I'm making rounds in the hospital because we could still admit and discharge our own patients. And I was in the physician lounge and saw a bunch of physicians there. And I said, out of curiosity, when do you talk to your patients about diabetes? And they said, when they become diabetic. And I thought, wow, that is way too late. And so
Yeah.
at that point, I had already instituted some type of program with the patients that I had, because I was trying to figure out how to explain nutrition. And nutrition is a very dry subject. I saw people's eyes just starting to close. So I came up with the anti-inflammatory diet, and I included everything that would decrease inflammation in the body, and everything was broken down into food group, and everything was low in glycemic index. And always encouraged them about anything they could do to get off the couch. So, if it wasn't on the list of foods to eat, they weren't supposed to eat it. And it somehow turned into a game where every 3 months they come in for the hemoglobin A1C. And if the number stayed the same, it was a win. If it decreased, it was a win. But if it went up, they lost. And it was the ones that lost that were devastated. So they would try so hard for the next 3 months to be able to get their numbers lower. And it worked out so significantly. It was unbelievable. So then I ended up going for my doctorate degree, and I chose a program where you have to find a gap in your practice and then fix it. And so because I had already done that, I spoke with my advisor and said it would be more of a retrospective analysis. So I did a chart review to see where they started and where they ended. I used SPSS, and it was statistically significant that everybody who was in the research itself. So again, inclusion, exclusion criteria, they could never have been diagnosed with diabetes. They could never have been on medication like metformin, even if it was used for non-diabetic reasons. And then people who were diabetic couldn't be in the research, but they were also put on the same plan. And all the way around, it was statistically significant. And it was just really, having somebody there just to guide you. I had one patient who thought that crackers is listed as the devil, so not to eat those. And he would eat like a sleeve of crackers, saltine crackers at night, thinking that would be better than candy. And he became diabetic.
Oh, I believe it.
Just from saltine crackers. So then we had to go
know.
down that whole rabbit hole of the flour in this country and how bad it is for you, and it causes autoimmune diseases and inflammation and diabetes and cancers and everything else. So it was a big learning experience for them, but at the same time, whenever you're doing anything like that, you learn more about it yourself.
Yeah. Yeah.
So that's how I got involved with more. I actually went back to school for functional medicine after that. So that was a good way for me to kind of segue into functional medicine and get my certification that way.
Right. And so now your main focus is Lyme disease, right?
It is.
Okay. So what kind of inspired you to shift into that?
So when I opened up my own practice in 2016, and in 2017, my son had started with a lot of different symptoms. We had gone scuba diving, couple years before that. He had been diving since he was 12 years old. My younger one was diving since he was 10. So it wasn't anything new we did. We were about 100 feet down. He had a lot of pain in his lower abdomen. When I brought him back to the hotel, it was the tiniest little hernia I could feel. Brought him to his doctor, who said the same thing. Was kind of surprised that the pain would be that severe. And took him to the surgeon. When they did the surgery, they found his abdominal wall they described it as Swiss cheese. So from the top of the abdominal wall down to the pelvic area was just all hernias. And he didn't have any risk factors. He was thin, he was muscular. There was no reason for him to, he didn't eat junk, nothing that would cause something like this. He had gotten bitten by a tick when he was 6 years old, had developed the bullseye rash, brought him to the pediatrician, who put him on antibiotics. And if I had to guess, maybe 10 days worth, which clearly didn't work. So now 13 years later, we didn't realize that even though he was asymptomatic, the bacteria was using his connective tissue as energy. And that's where those hernias were coming from. And it was right after the surgery, because whenever somebody has a chronic form of Lyme disease, where it just has been in their body without any signs or symptoms, even though it's doing harm, you just don't always have the symptoms until you have a trigger. So whether it's a death in the family, a serious illness, surgery, car accident, like whatever it is going to really,
some trauma.
Some type of trauma is going to drop your immune system, and that's where all the symptoms start. And that's what happened with him. And his symptoms were predominantly in the bladder. Like, it started immediately in the bladder, in the testicles, in the legs with pain. He had a lot of brain fog, a lot of fatigue. I mean, we were so worried about him because we really didn't know what was going on. We were so worried about him that the poor kid, if he was taking a nap on the couch, because he and his girlfriend have their own house, one of us would be knocking on his door because he didn't answer his phone, because it was that scary, because we didn't know what was going on. So in the meantime, he's seeing a number of doctors. By the time he was about 27, they told him it was all in his head. And I'm just researching and researching and researching. It got so bad that the only one who really, really listened to him, I have to say, is his urologist, Dr. Devaney. I have to throw his name out there. I had to call him on Easter Sunday morning because my son could not urinate, and he met us at his office that morning to teach him how to self-catheterize himself. So it was a nightmare, literally. So now he's 29, a month away from turning 30, and I found one research article from the Journal of Urology that had his exact symptoms, and I contacted the researcher who told me about the International Lyme-Associated Disease Society, otherwise known as ILADS, which I've never heard of before. And I joined ILADS. I found Dr. Richard Horowitz, who was a Lyme expert. I went away for training with him. I did preceptorship with him, and started my son on treatment. And I'm happy to say he's 36 years old. He's much better than he was. He was on the right path. Then he decided to be a person again. And I go through this with every single patient I've had since. You get so tired of being a patient. You get so tired of not being able to do this or that. So he started eating a little bit more sugar. He started drinking a little bit more beer. He stopped coming here for the infrared saunas and the IV vitamin C. And whenever that happens, if there's even one straggler left over, it'll start the process all over again. So now we're kind of reeling him in to get everything back on track. So he's doing fantastic, thank God. So because of the bladder issue, I actually trained with Ruth Kriz, who specializes in chronic urinary tract infections. And when she retired, she asked if she could put me on her website so people can find somebody who can help them. So right now I have patients throughout the country between Lyme disease, chronic urinary tract infections, chronic inflammation, and I have 2 patients in Australia right now. So it's a bigger problem than I think we ever realized it was.
Yeah. Yeah, it's so amazing. I mean, I know quite a few practitioners who are part of ILADS and who go to the conferences and speak and all that kind of thing. But it's I know people, especially being in Connecticut. I mean, everybody's familiar with Lyme disease, right? And it's you probably everybody knows somebody who's had it. And but I think what people don't think about is just the severity of it and how long it potentially can last. It's crazy.
It's crazy. I'm in the process of doing a research study right now. I had sent out surveys to over 300 providers just to find where the knowledge deficit is. And I got 26 back. So I've been a speaker for the Connecticut APRN Society 2 years in a row. The first year, I felt like my talk was much too technical. It was all about the labs, all the differences. I felt like it went over a lot of people's heads. So the
Mm.
second talk I did was much more clinical. I was doing more case studies. Patient comes in, I did 4 case studies, tried to explain the testing, the poor testing we have through LabCorp Request, and the testing through IGeneX, how it's really superior. And at the time, I have to say, I was very disenchanted with the medical community because they were not looking at Lyme disease the way I was looking at Lyme disease. And then somebody in the audience at the second conference works in the ER and said that, he would follow things like Up to Date. Up to Date is it's an app that we can use to find out the most up-to-date information, but it's also skewed. So it's based on what IDSA says, it's based on what CDC says, it's based on what the American Medical Association says. So it's not really the best way to get the most information for something that is not well-known and politically a
Oh yeah.
disaster.
Let's not go
Just a
there.
dis-
I
Yeah.
want to talk more about that. We got to go to a short break, but yeah, when we come back, we're going to explore more about that app because I'd never heard of that either. So
Oh, okay. Perfect.
you're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we will be exploring more with Dr. Pamela Cipriano on Lyme disease. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. And before we continue, I just want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com or at either of my 2 publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Dr. Pamela Cipriano at her website, which is www.thepracticeofhealthandwellness.com. So welcome back, Dr. Cipriano. Before we just went to break, you were talking about an app that I've never heard of either. So can you just reiterate, what you were saying about that?
Sure. So Up to Date is something we use predominantly in the hospital, and it has has great information there if you have a patient that has a disease process that is not that well known. And so what they do is they'll use research from other journal articles and be able to give you a synopsis of what to expect, what the risk factors are, what the common ailments are, how to testing to do, and how to treat. Unfortunately, with Lyme disease, it's antiquated because they're still talking about, if somebody presents with a bullseye rash, you give them 10 to 14 days of antibiotics. The research shows it does not work. You need at least a month of antibiotics. Another problem is if somebody comes in with a tick bite, there's nothing in up to date to suggest what you would do for something like that because it's always talking about the bullseye rash. But one tick can carry up to 14 different diseases. And Lyme disease is only one of 14 different diseases, and the only one that causes that bullseye rash. No other
Yeah,
disease causes it.
right, I was going to say, because a lot of people don't even present with that rash.
Most
So
don't.
they,
Only
so they
about,
think they don't have Lyme disease.
that's correct. And only
Yeah.
about 20% of 20 to 30, 50% of people actually do get the rash. So you have a huge amount of people who do have Lyme disease who just never get the rash.
Yeah.
So it's all based on your immune system. So if your immune system is poor, you're not going to get the rash. And it's just it's unfortunate that the education for it is so low. So when I had done my second talk, I actually realized this was a problem with education and, put down a piece of paper and had anybody write their names and emails and phone numbers if they wanted to get more education on Lyme and other tick-borne diseases. And 17 people signed up for it and 2 people showed up.
Wow.
So I had 2 nurse practitioners who showed up. It was the entire month of February in this year. And every week, it was every Saturday. It started at 2:30 and generally it would end between like 7 and 8:30 because there's so much to go over.
Oh my God,
and
6 hours?
so many
Wow.
questions. So that was
Yeah.
like the first one was for Lyme disease. The second week was for Bartonella. The third week was for babesiosis. And the fourth week, I kind of threw everything else in, ehrlichiosis, tularemia, anaplasma. I mean, there's so many other acute fever, Rocky Mountain spotted fever. There's so many diseases.
You almost have to really just specialize in Lyme, I feel like,
Yes.
because if you're a nurse practitioner or integrative APRN or even like a medical doctor, even a naturopath, like how do you handle like all the other things that people come to you with in terms of the knowledge that you need for those specific issues? When Lyme to me is like it's its own world. I mean,
It
really.
is. It definitely is. But what will happen with it is it affects the entire body.
Mhm.
So something like Lyme disease, you can have something called neuroborreliosis, where it causes psychiatric problems in the brain. It causes difficulty urinating, where your bladder is not, the messages aren't getting sent between the bladder and the brain correctly. And so sometimes, like what was happening with my son was he had to void, he couldn't void because his bladder wasn't contracting properly. And that was from the neuroborreliosis.
Wow.
So a lot of it is you have to get rid of the bacteria itself. You have to make sure that you're keeping the microbiome in the gut nice and healthy with probiotics so that you're not decreasing the ability for the body to produce proper amounts of neurotransmitters like, epinephrine, norepinephrine, dopamine, all those kinds of things that keep the brain nice and healthy. So it's really treating the entire body. There's nothing
Yeah.
about just treating Lyme disease or just treating Bartonella, like you're literally treating the entire body. And it could affect high blood pressure. It could affect heart disease. It can affect liver. It affects obesity. People gain weight when they have a tick-borne disease, either gain weight or they lose weight. So I feel like being an acute care nurse practitioner and having the critical care background that I did really helped me to be able to treat the entire body from head to toe.
Yeah, because not only is it all those different bacterias that you listed off, but now you're dealing with the potential of every single organ system,
Exactly.
not necessarily in one person, but in different people, how it's presenting, it could be attacking different organ systems.
It
So
can.
let's talk a little bit about how chronic Lyme disease impacts overall health. Obviously, we just said like it can impact every single organ system, but just wherever you want to get specific with that, go ahead. And then like what approaches do you use for treatment?
So when I test, I never just test for Lyme disease. I send everything out to IGeneX. And IGeneX does not, I can't say IGeneX doesn't accept insurance. Insurance companies will not cover IGeneX. The only insurance company that covers IGeneX is straight Medicare. So if you have like Medicare with AARP, they will pay 100% for IGeneX. But if you have an Advantage plan that is considered just a regular insurance company, even though it is Medicare, they will not pay for IGeneX. And I've told patients to get on the phone with the insurance company and start complaining because when they sold them this Advantage plan, they were guaranteed that whatever Medicare paid for, they were going to still pay for. Plus, they were going to get A, B, C, D, and all the bells and whistles.
Yep.
That was a lie. They do not pay for IGeneX. So because it's expensive, what I'll generally do is local testing. I'll test for every other tick-borne disease, which is pretty accurate. The ones that are not accurate is Lyme disease, and I'll tell you why. So LabCorp and Quest check for Borrelia burgdorferi, which is Lyme disease in the United States. There's about 7 different Borrelias. IGeneX tests for all the Borrelias because you may not have the US strain, but you might have the European strain or you might have the Asian strain. So if you have either of those strains, the labs from LabCorp and Quest are going to be a false negative because they're not testing for those. So it's going to come back negative. That's why I like to use IGeneX for Lyme disease. Bartonella, same thing. You can get it from pretty much any insect. You can get it from ticks, spiders, horseflies, fleas, sand fleas. Let's
Mosquitoes?
see. They haven't seen the cross from mosquitoes yet, and I think it's because the mosquitoes aren't attached to you for a long period of time.
Right.
But it is that's like cat scratch fever is Bartonella. Trench fever from World War I is Bartonella. So there's several different forms of Bartonella, but we really only knew about 2, cat scratch fever and trench fever. Well, there's about 7 different types of Bartonella. And again, I have never gotten a positive Bartonella through Quest or LabCorp. In the 7, 8 years I've been doing this, not once. So that definitely goes to IGeneX. And same thing, IGeneX tests for all the different strains. And then babesiosis is a parasite that lives in the red blood cell. I've gotten maybe 1 or 2 positives through LabCorp or Quest, but I've gotten the vast majority through IGeneX because they're testing for so many different babesiosis, not just Duncani or Microti. There's so many other ones that can be tested.
So first off, one of the most important things is where you're getting your lab testing. Like I'm saying, like I'm talking to like the layperson listening to this, or maybe even some practitioners who are listening to this, where you're doing your testing for your patient or as a patient, where you're getting your testing done, because you could go to the Quest or these other bigger labs and they're not even testing for the right thing.
Right.
So it's going to come back negative, and then you're going to go
Sure.
down a completely different path when in reality the person does have some form of Lyme disease.
Correct.
Yeah.
That's absolutely correct.
So let's say we do the testing right and everything comes back and they have one of these, I mean, obviously in this, we could probably do like 20 podcasts on this, honestly, like with the amount of information, but I mean, like from a basic perspective, so what are symptoms that sometimes people do have? And let's start with that. So
for Lyme disease, my son's symptoms were very vague. They were not the typical Lyme disease symptoms. However, now that I'm treating chronic urinary tract infections, I'm realizing they all have the same symptoms that my son had. So that's like a subpopulation. But the vast majority, the more common symptoms of Lyme disease is going to be migrating joint pain. So sometimes it's the knee, sometimes it's the elbow, sometimes it's the shoulder. Migrating muscle pain. Sometimes you're getting muscle pain or weakness in the bicep. Sometimes it's the quadricep. Sometimes it's the calf muscle. Headaches are a big one. Neck cracking when you're trying to move your neck. Sometimes it feels like it's going to get stiff. Fatigue. Profound fatigue, brain fog, where you just can't seem to think through things. That has been a huge problem for people with Lyme disease. For Bartonella, it's going to be more neurological. So I've had patients in my office, many of them will have burning sensation under their feet. That's a huge sign. Pain or burning sensation down their legs, sometimes burning in their arms. I've had gosh, more than 5 patients with a burning sensation coming up their spine until it reaches over their head. And they'll almost have like an absent seizure while they're talking to me. They just kind of go out in this zone and they call it a spell until the spell passes. So what
Wow.
I normally do is have not only the patient come, but always bring somebody else with you because you have the brain fog, you have the fatigue, you're really not feeling good. And you're in a doctor's office, you're going to be told that you have some type of tick-borne disease. Your brain just shuts down anyway whenever you go to the doctor's office. So if they could bring somebody else with them as a second set of ears, and I always say bring a notebook and write stuff down because we go over so much. Like an appointment is usually about 3 hours. I'm not
Wow.
exaggerating.
Yeah, no, I believe it.
Babesiosis is a parasite, and that's going to be more almost like malaria. So malaria and babesiosis are cousins. So it'll have like air hunger. You can't seem to take in a deep enough breath. You'll have ringing in the ears. They all have that fatigue and the brain fog. But those are like the most common symptoms that you'll see with those three.
Also, I think as you were talking, this just popped into my head. I'm thinking like, I wonder if people are thinking like, well, I don't go in the woods, so it can't be like a tick thing. Nowadays, I mean, I think maybe there's more education out about that, but one thing I wanted to get out was like, you don't necessarily have to be hiking in the woods anymore. I
No,
mean, they're everywhere, right? It's
I had an
not to
elderly.
scare people, but
No, it's true.
they're in
I
your
was
grass probably and stuff.
I was working at the primary care office when I first left the hospital. I when I left the hospital, I was still working at the hospital, by the way. So I'm a workaholic. I don't know how to not do that.
Yeah.
I was working in the doctor's office, and then on the weekends I was either working as a hospitalist or I was working in the ER. So the whole staff and the nurses all knew me. And I had a patient, an elderly patient who came in, he was 86 years old. The only thing he did was to leave his house, was to get the paper that was at the end of his driveway, and then go back to the house, or he'd get in the car to go to the grocery store and then go back. And he didn't garden anymore. He didn't mow his lawn anymore. He didn't do anything outside anymore. And he came to the office with severe brain fog, like almost like a dementia, aches and pains everywhere. I mean, his family was about to put him into a nursing home because they just felt like he had reached that age where he couldn't live alone any longer. He slept like all day. He was really developing dementia and all. And it just wasn't logical for me because I've known this guy for at least a year and a half since I started at the practice, and this was like a sudden onset of symptoms. And so, of course, I tested him for a bunch of autoimmune diseases, including tick-borne diseases. And meanwhile, he ends up in the hospital, in the ER. I get a call from the ER to say, like, what do you want us to do with him? And as I'm on the phone with them, I get the results back from my Genix. He was positive for Lyme disease. And I said, I was so excited. Oh my God.
Now
If
I
you
know
can
what to do.
yeah, if we can give him some IV Doxy, I said they'll at least get him started and then we can get him on the oral form once he's out of the hospital. And just like that, he was completely better. So you
Wow,
don't
that's
have to
amazing.
be in the woods. You don't have to
Yeah,
live in the woods. You don't have to go
yeah.
hiking. It's amazing. These things don't fly, but they weigh nothing. So a good gust of wind is going to just throw them wherever they're going to go.
Wow. Yeah, for sure, for sure. Um, let's just talk about, we have a couple minutes before we have to go to break, but let's just get started on this. What unique approaches do you use in your treatment plans?
So I went away for training with Dr. Richard Horowitz. And the reason I liked him the most was because he incorporates both Eastern and Western medicine, and that's how I run my practice. So we do antibiotics, but we also do natural antimicrobials. I've read Dr. Bruner's books. I've read so many other books on naturopathy, including Dr. Zhang's books, and they all recommend starting with antibiotics because the disease process can be so severe. And even though they're not fans of antibiotics, as I'm not, it's the best
Yeah,
way to at least get a hold of it.
right.
Lyme disease and babesiosis, they're all going to be different treatments, but I always start everybody on doxycycline or minocycline, one of the tetracyclines. And I do that along with cefuroxime because you want to cover the intracellular and cell wall forms of bacteria. I also incorporate like a macrolide for babesiosis and for Bartonella because they have a different structure when it comes to how to kill them off. And that medication is necessary because babesiosis is a cousin of malaria. We also use Malarone, which is used for malaria. But once I kind of get a hold on it, then what I'll try and do is switch everything over to all natural antimicrobials. I've tried combining them in the beginning with the antibiotics, and people could not tolerate it. They would kill off so much bacteria that the inflammation from the die-off would cause, it was almost being like their symptoms on steroids, and they would just be
Yeah, I've heard,
so
yeah,
sick.
I've
So
heard that
trying to
too. So,
detox them.
right, right. Well, let's get to that. We got to go to a quick break, but we're we're talking more with Dr. Pamela Cipriano about Lyme disease. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden, and I'm talking today with Dr. Pamela Cipriano. Her website is www.thepracticeofhealthandwellness.com. Before we just took this last break, we were going through, all of the medications that people potentially need to be on, which is important. I think a lot of, people listening to my show, they listen because they want to do everything naturally or as much as they can. But I think it's important to stress that with this particular issue, with Lyme disease and all these, co-infections, that you do need traditional antibiotics. And then, from there, once the person is kind of stabilized, as we just went to break, you were talking about like all of the detoxing and things like that goes on. So what are the natural therapies that you start to move someone to after they're really more stabilized with the antibiotics?
So resveratrol is fantastic for pretty much all tick-borne diseases. Cat's claw is another one that is an all-natural antimicrobial. There's a list of things that I generally use to try and get people on the right track, and it all is based on which disease process is it. Is it Lyme disease? Is it Bartonella? Is it Babesia? Is it Ehrlichia? There's like so many other things. Cat's claw and resveratrol will cover almost all of them, but then we have to differentiate between some of the other ones when we get down to all of the list of bacteria that one person can have. One thing I should mention is Lyme disease is the only one that causes the erythema migrans rash or the bullseye rash. There's a rash that's called Stari. It's a southern, oh boy, southern tick. I know I'm going to say it wrong, but it is it's a tick bite from southern areas of the United States. It will give a similar appearance to a bullseye rash. And it's still treated the same way with the tetracyclines. But more importantly is if you have or if you find stretch marks or striae on your body that are not white but more red, and if you hit them and push on them and they blanch and they go against the skin grain. So the skin, you can kind of notice where the skin is going. Like our chest will kind of go, this way. Same thing with our belly. It goes more to the side. Our legs tend to go more down. If you have stretch marks that are red in appearance and are going against the grain of the skin, that is most likely Bartonella. It's called a Bartonella striae, and it'll show up in areas that you would never expect a stretch marks to be. So I've had patients where, like it's in the corner of the armpit. I've had somebody smack in the middle of their back, like literally smack in the middle of their back. These red lines going straight across. You wouldn't expect something like that there. So what I started doing was asking people if they had stretch marks, and, especially if the person who's either, if it's a child, then their parent is with them, or if it's, a couple, the other person is with them, will generally say, oh yeah, I happen to notice, stretch marks, but I didn't know what they were. I just thought they were stretch marks. So then I usually have the person, strip, I put them with a gown on just so I could really take a look at the entire body. And it's amazing how many patients I found with those striae on them. And if a provider doesn't know if it is or not, they can actually biopsy that area. They could do a punch biopsy and send it off to the lab, and it will show the Bartonella species.
Oh, wow.
Yeah.
That's interesting.
Mm-hmm.
Yeah. So you mentioned a few different supplements. Anything else that comes to mind that?
So here we do a lot of infrared sauna with
Okay.
red light therapy and far rays. We also do a lot of IV vitamin C, higher doses. We start low and then we eventually get up to 60 grams of vitamin C in a liter bag. And there's a lot of research on this, not only
Right.
for cancer, but there was a naturopathic group that recently did it, and found that it was statistically significant for patients to get rid of some of the inflammation and to boost the immune system. And that's really what helped my son. That's why we got back on the IV vitamin C's before we start any antibiotics, because that alone can sometimes really get the person over the hump and get them to a better place. But this whole office is designed because of my son, because it was always trying to figure out how I thought I was going to lose him, I'll be honest with you. So everything here is just trying to figure out how I can help him. And because of him, I'm able to help so many other people now.
Wow. This is gonna, I mean, I feel like this might be a naive question. How many people died from Lyme disease, and how, like, what's the statistics on that?
So Lyme disease itself, if it's only Lyme, and most patients don't have only one tick-borne disease, they usually will die of suicide because they're
Really?
going to providers that don't know anything about Lyme. They're telling them it's all in their head. They can't find anything wrong with them. They don't look sick is the big thing, is they don't look sick. And so now you have family members just calling them lazy, and why don't you just get out of bed and work like the rest of us? I mean, it is horrible what these poor people are going through. And after suffering for so long and not finding a Lyme literate provider, they end up just saying, this isn't for me. And then they just
Wow.
commit suicide. And there's been a number of cases where people commit suicide. For something like Bartonella, Bartonella is a nasty, nasty disease. I've had patients die. They were misdiagnosed with ALS, misdiagnosed with Parkinson's disease. The ALS one was probably the most heartbreaking one. She was seeing a different Lyme literate provider who had prescribed or had ordered IV Rocephin, because something like that, when you're that severe and you're in a wheelchair, we definitely start the IVs with the PICC line. And I don't know what happened in the office, but it never got ordered. And so she ended up coming to this office, and we got the Rocephin started immediately. But by then, I don't even know how many weeks passed before, she went from that provider to this office. And at that point, like I said, she was already in a wheelchair. I was trying to work with Yale Neurology and explaining that, she does have Bartonella. I sent them all of the lab work from IGeneX. She went there for an evaluation, and they wanted to see her back there in 6 weeks. So this was a Friday. And by the time she left, it was 6:30, so they were already closed. So Monday morning, I left myself a note to call them and say, she's not going to last 6 weeks. Like, if you're trying to see if she actually has ALS, let me know what the protocol is so I can start the process, because she's not going to survive. Well, Monday morning, I came in, and I'm going to get emotional because I always do. My staff was standing in front of my office door with her death certificate.
Oh, God.
She didn't even survive the weekend. So I'm very
Yeah, it's awful.
passionate
Yeah,
about
no,
this.
no.
I
Yeah,
see,
because yep.
it's so horrible. But, and I'm not saying anything about Yale Neurology, like, they don't know anything about Bartonella.
Right.
They're
That's the
thinking,
thing.
they're thinking more on neuromodulators, neurological disorders, things like that. Another thing about Bartonella and Babesia is the vast majority of people in behavioral health actually have a tick-borne disease, because it causes such inflammation that it changes the brain structure and the neurotransmitters, because now everything, like I said, the neurotransmitter is actually made in the gut and then transported to the brain. Well, if this is unhealthy because you're not eating properly, because you have all this bacteria in your system and you're craving sugar, that's where that bacteria comes in, you're
Yep.
never going to get better. So now we have schizophrenia, schizoaffective disorder, bipolar disorder, mania. I mean, I tried to do a conference for psychiatrists so that they could understand more about tick-borne diseases and the population that they're treating. And I had all psychologists showed up, but no psychiatrists. So I was happy to have the psychologists there, but they're not the ones that prescribe the medication, and they're not the ones that round on patients in behavioral health. So it was a bust for me. Like, here I was trying to just get the word out. So what I started doing, and this is my 4th month doing it, every month it's a free seminar open to the public here at my office. It's actually going to be today at 6:30. It's going to start. And we do some type of a tick-borne disease every single month so that they could understand, what is going on. This one is going to be on being diagnosed with a disorder that is not curable. So ALS, Parkinson's disease, Alzheimer's disease, schizoaffective disorder, schizophrenia, bipolar, where you're just getting medication to put a Band-Aid on it. But what if it's because of a tick-borne disease? If we treat the tick-borne disease, we get rid of all of the inflammation through detoxing, all of this clears up. So that's what today's is going to be on.
That's amazing. And honestly, I mean, I know quite a few Lyme practitioners. I think you are the first person that has ever that has said verbally this connection to mental health. Because
Yep.
I don't think I've ever talked about that with anybody else.
It's huge. And there is a Dr. Branfield who is part of iLabs who just published a research study on a 14-year-old young man who was bitten by a tick. And right after the tick bite, he developed psychiatric disorders. And nobody was picking up on it. Everybody just thought he was bipolar and just throwing medication, but nobody ever got down to the cause of why did this occur. And he ended up using PCP because it was the only thing that got his brain from this disorganized state to more organized. And it did not end well. He ended up becoming homicidal, and he ended up committing suicide. And he was only 31 years old. So it was one of the saddest studies, but he's really trying to get the word out there. And 30 something years ago, when I was in nursing school, we were taught all psychiatric disorders start in the gut. I forgot that. It's the inflammation. It's the change in the microbiome that causes the psychiatric disorders. But after getting into medicine for so long, you forget certain things. And I did forget about that. And I'm so glad when he came out with that research study and that's what he talked about, I was like, oh my God, I can't believe I actually forgot about that. So now everybody is on probiotics at least twice a day. Like everything's about gut health. The anti-inflammatory diet is, stressed. Do not eat anything that's not on this diet, because that's how people get better quicker. And it's not limiting, but it's very healthy. So if you're looking for McDonald's and Devil Dogs, it's not going to be listed.
Nobody should be eating those anyway.
I agree.
All my listeners know.
I appreciate that.
They're in big trouble if I catch them. So, well, let's shift to that, because, one of the things I wanted to ask you is, like, what are some common signs of chronic inflammation, and why do we need to address this early?
So what I'm finding with the chronic urinary tract infections is when patients are getting diagnosed with this, and again, here we go with the laboratories again. If we go through LabCorp, Quest, hospital labs where they're doing a urine culture, sometimes it doesn't culture out because sometimes the infection isn't in the urine, it's actually embedded in the bladder. And that's more like nope. Wrong word. I was gonna say ulcerative colitis, but that's not what I'm looking for. It's more related to when the membrane gets separated from the bladder wall, which is a protective membrane to prevent bacteria from adhering to the bladder itself. When people end up experiencing something like this, their urines are always coming back clean. So I use Microgen DX. Microgen does it differently. They do the phase 1 is a simple urine culture like you would get any other place. And if that's positive, that's great. But then they do a phase 2, which is a DNA analysis to see what is in the bladder wall. And that's how we get rid of that bacteria. But I can give somebody antibiotics for 3 years straight and not get rid of the bacteria because the bacteria is going to hide in biofilm. Biofilm is a very, very tough structure that's very difficult to break open. And when I find this, I always test them for tick-borne diseases. There is a researcher, her name is Eva Sappi out of the University of New Haven, and she's a botanist by trade, and she specializes in Lyme disease. And she was the one, I don't know if anybody or any of your listeners read her research about liquid stevia. So she tried everything in a petri dish to break open this biofilm, including Clorox bleach and gasoline, and nothing would break it open. And then she started using plant extracts, and she found that liquid stevia was the one thing that broke open that biofilm.
That's
So when
awesome. I want to keep, let's talk about that because that's really fascinating.
Okay.
We gotta go to a break. When we come back, we'll be talking more with Dr. Pamela Cipriano. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. And I'm talking today with Dr. Pamela Cipriano, and her website is www.thepracticeofhealthandwellness.com. So right before we went to break, Dr. Cipriano, we were talking about basically, like what are signs of chronic inflammation? And you started to tell us about this research that with stevia, I think you said?
Stevia, yep, it was done by Dr. Eva Sappi. She tried stevia in a petri dish and was able to break open the biofilm. And then she tried it in people and it didn't work. So she took all her research to Dr. Richard Horowitz, who was the one who trained me, and he does a lot of clinical trials in his office. So he broke people into two separate groups. One received only liquid stevia. The other received serrapeptase, which is a derivative of silkworm, to help break open the biofilm. So silkworms, for them to be able to come out of their cocoon and become a silkworm, they have to actually excrete something called serrapeptase, which eats away at the cocoon and they come out a moth. So when it's taken internally, it eats away at so many different things, not only biofilm, but it also eats away at coronary artery disease. It eats away at lipomas, if you have cysts, things like that. Anything that's a non-living structure, it will eat away. And so that study showed that in a person, you needed both serrapeptase and liquid stevia to break open the biofilm and kill off those persister cells. So those persister cells, if you think about something like tuberculosis, something like tuberculosis has so many persister cells that you have to be on antibiotics for a prolonged period of time. But if we give you something like liquid stevia and serrapeptase, or if we even use like liquid stevia and nattokinase or lumbrokinase, anything's going to break open that biofilm, we get to kill off those persister cells so much quicker, which we didn't know with tuberculosis.
Wow. So, why is it so important to address inflammation early? I mean, I think that's, I almost feel silly asking that question, but I think like one thing I would say is that I feel like it's possible that you could have a lot of inflammation and not necessarily know it, like things that are going on internally in the body.
That is so true. So the vast majority of people I see have inflammation everywhere. And it's the inflammation, I don't have my little paper with me, but I was hoping I might have it in here. The anti-inflammatory diet I give to people, I found this little chubby guy on there that had inflammation written on its tummy, and it had all the things that food causes, all the inflammation food causes, and it's pretty much every disease process known to man is caused from inflammation. So that's the most important thing, is to get rid of the inflammation, because if we don't get rid of the inflammation, we don't get rid of the disease process. I can give you all the antibiotics in the world, I'm not going to get you better. Besides the fact the inflammation is going to kill off so much bacteria, which is going to increase the amount of inflammation. So detoxing, proper diet, drinking half your body weight in ounces of water, not eating flour that's from this country. I actually started using Manny's Choice flour that is from Italy, and the distributor is here in the United States in Oregon.
Oh, what
Had
is that
developed,
again? Say that again, because I bet people will be interested in that.
good. It's called Manny'sChoiceFlour.com.
Okay.
So
Yep.
MANNYS
Yep.
choiceflour.com, no apostrophe. She is a nutritionist and ended up getting her MBA and had breast cancer. And her diet was so clean, she had no idea how she could possibly have gotten breast cancer. And she took a deep dive into our diet. She found it was from the flour. So the flour in this country is grown in poor soil. It's overprocessed. It's
Pesticides.
glyphosate is used for the pesticides. The flour is then again overprocessed and then bleached. So by the time you're done with it, you're pretty much eating a sugar stick. It causes all the same issues that something like sugar is going to cause. Our flour in this country is banned in other countries. Other countries are not allowed to buy our flour.
A lot of
That's
things are
how bad
banned in other countries.
That's how bad it is. So
Yep.
we don't eat any flour, any bread, anything else unless I make it. So now I went back to making bread, which I didn't have time to do today, but generally is my Monday day thing to make up flour. I start in the morning. It's the old fashioned Italian way, punching it down every 2
Wow.
hours.
Awesome.
It rise. I look like Mama Leone.
Yeah. Oh my God, that's amazing. People are like, on top of everything else she's doing, researching all this stuff for Lyme disease and all these co-infections, she also makes her own bread.
So my kids come to the house, go in the freezer and grab whatever they want.
That's amazing.
So I've always been health conscious. I think if it was born this way, I'm not sure where it started from, but I love what I do. I love getting
Yes.
people healthy. I love figuring out why you're not feeling good and getting you better. Like that makes me so happy.
Well, I mean, you can totally see like your passion is very clear, which is amazing. I mean, look, there needs to be more practitioners like you, honestly.
Yeah, yeah, I
You know,
completely agree. Completely
so
agree.
what are your thoughts on what the future is of preventative medicine and chronic disease management?
I think it's really going in the positive direction, and it's not because of doctors, it's because of patients.
Yeah,
Patients are sick of being sick. They're sick of being on medication. They're sick of not understanding why they can't come off their meds. A lot of them take it into their own hands of just trying to go on a diet and lose weight and things like that. And they're the ones that generally will just find me just for the functional medicine part of it, just to get healthy. So it's really going in the right direction, but it's not through medicine. It's because of patients. Patients are demanding more from their providers, and it's unfortunate that a lot of providers don't go back to school for functional medicine because you're missing an enormous part of how to heal the body naturally. You know, if you have high blood pressure and you're given an hypertensive, that's a Band-Aid. That's not doing anything to find the root cause of why you have high blood pressure. Same thing with high cholesterol. You know, you could change your diet as much as you want, but until you find the actual root cause of why you have high cholesterol, you're just going to stay on a statin, you know?
yeah,
If I could say
yeah.
one more thing about that, I'm sorry if we're running out of time, but this is
No,
really
go ahead.
important.
Go ahead.
So with cholesterol, what I found is I've had patients whose cholesterol levels were off the charts. Like I had this one guy who very fit, very busy job. His total cholesterol was over 400. His LDL, which is a bad cholesterol that should be less than 99, was over 300. So he looked like on paper, a heart attack waiting to happen. I got a coronary calcium score when he could not tolerate the statin at all. He just couldn't take it. He had zero coronary calcium, zero. His
Isn't
coronary
that
calcium
interesting?
score was zero. Then I
Yeah.
have somebody else whose cholesterol levels are spot on and their score is in the 2000s.
Yep.
So that was just like, make sure who's ever listening to this podcast, ask your doctor for a coronary calcium score. It's a low dose CAT scan. The insurance companies will not pay for it because they'll lose money on you if you don't have your heart attack. So if you
Right.
can prevent the ability to have a heart attack by having this coronary calcium score, go to a place that is not owned by a hospital. It'll cost around $99. In the state of Connecticut, it costs $99. I know in other states there's a different price, but like here it's $99. If somebody went to Yukon or Hartford, they'd be paying $400 or $500 because they have to pay that convenience fee. So try and shop around, you know, like I said, low dose CAT scan, even if you get just one to find out where you're at. And then if you need to go on a statin, absolutely do that because it's going to help to stabilize the plaque in your coronary arteries to help prevent a heart attack. But if you don't need that statin because your cholesterol levels are high, but your coronary calcium level is low, then get off the statin.
Yeah. Yeah, definitely. Well, I think you're right as far as like, what is happening in terms of preventative medicine and the direction that it's going in and all of that. I mean, definitely I feel like it is driven by the population now. I mean,
I
people are
agree.
just or have just finally have we've gotten to that tipping point of enough
Mhm.
people like just not wanting to be on medication or realizing that the medication is not really fixing the problem. Like you said, it's just putting a band-aid on it. And I think, I think we're going in the right direction for sure. And I love what you do and you're so passionate about it, which is amazing. And, I think, like I said, we need more people like you for sure.
I really
And
appreciate
I'm
that. Thank
sure
you.
that people will be reaching out, and learning more about you at your website for sure. But thank you for everything that you do.
Thank you so
And
much for that.
yeah, yeah. And especially just with the amount, like I said earlier, like Lyme is a full-time job alone. Like just knowing everything that you know is amazing.
Thank you. I think it kind of goes hand in hand. Like you have to understand how the
Yep.
body works, how to decrease the ability for the body, or increase the ability for the body to actually improve, get rid of the
Yep.
inflammation. And that's half the job. It really, really is.
Yeah. Yeah. Well, thank you. This has been awesome. Like I said, we
Thank
could
you
probably
so
do
much.
50 more podcasts on this for sure, but thanks for all the info you gave us today. And I want to thank all of you for tuning into the Dr. Diane Show. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific. Next time, we'll be discussing more about the power of thoughts and beliefs and the impact they have on your life. Have a great week, and I'll see you back here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on TransformationTalkRadio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.